Hey guys, this is Dr. Rob, and I wanted to welcome you to another one of my whiteboard sessions. Today we are going to talk about the hot topic of intermittent fasting. We're going to talk about what it is. We're going to talk about who absolutely should not do it, because there's three types of people that should not do intermittent fasting. And then we're going to talk about why I feel it's essential to do lymphatic cleansing, what lymphatic cleansing is, and why it's essential to do it when you're intermittent fasting. Okay, so first off, what's intermittent fasting? Basically, it is eating high quality foods for about 6 to 8 hours a day and then fasting the other 16 or so hours a day. It's essentially what it is. Now, who absolutely should not do intermittent fasting? I'm not going to tell you this soon. Stick around. I'll give you the info in just a second. Here's the benefits of intermittent fasting as far as what research has shown. The first thing is it increases insulin sensitivity. Insulin is the most powerful fat-storing hormone in your body. When insulin sensitivity is increased, it means you need less insulin to manage your blood sugar, which means you lose body fat much more quickly. Second cool thing about intermittent fasting is it's been shown to improve your Guerlain levels. What's Guerlain? It sounds like I'm gargling up food or something. Guerlain is a hormone that's associated with hunger. When you have enough of it, you're not hungry. When you have too little of it, you're hungry, like very hungry, like hangry, like not a good situation. So you want your Guerlain levels in adequate amounts, and intermittent fasting seems to improve your Guerlain levels, which makes you less hangry and much more enjoyable to be around. The third thing is it makes you fat adapted for energy production. What that means essentially is your body becomes more effective at burning and utilizing fat for energy. Number 4 is it's been shown to decrease inflammation in your body. So if you have joint pain, if you have autoimmune disease, inflammatory disorders, intermittent fasting might be a really good thing for you to do. And the last benefit of intermittent fasting is it's actually been shown to potentially reduce your risks of certain diseases like coronary artery disease, heart disease, and even some types of cancer. All right, now, who are the 3 people that should really be careful with doing intermittent fasting? Not yet. Hang on a little bit longer. So why then is it important to do lymphatic cleansing when you're doing intermittent fasting? Here's why it's so crucial. It boils down to results, in my opinion. When you're doing intermittent fasting, you're breaking down fat at a better rate. The fat molecules, the little globules of fat, some of them deposit into your lymphatic system and then are excreted out of your body through your feces. The problem is if your lymphatic system is congested and can't remove that fat from the body, it then makes it harder to lose weight and could potentially lessen your results from intermittent fasting. So always do some lymphatic cleansing. I got a whole procedure for that. I'm going to put the link right down here so you guys can see it and understand exactly what I mean by that. It's a really, really cool thing, and it definitely should be done during intermittent fasting. Okay, so who are the 3 people that could potentially have problems with intermittent fasting? The first person is, if you have adrenal fatigue, you have to be careful, because when you're doing intermittent fasting, you're going 16, 18 hours without eating. The adrenal glands are designed to help maintain your blood sugars between meals. When the adrenals are too weak, they have troubles doing that. So your blood sugar can fall, you can become irritable. In addition to that, sometimes cortisol will get kicked up to compensate for the fact of you're not eating, and that could actually slow your ability to lose weight. So if you have problems with your adrenals, there's another link I'm going to put down here. You could read more about the symptoms, the major symptoms a person has when they have adrenal fatigue, as well as I included an A to Z adrenal guide, free, just read it. It's just information for you guys to help with anyone that thinks they might have adrenal fatigue. Okay, so the next person that's got to be a little careful with intermittent fasting is someone that has known hypoglycemia. And then the last person is someone that has pre-diabetes. One of the issues with hypoglycemia and prediabetes, much like the person with adrenal fatigue, when a person has prediabetes, their insulin level is often too high. And when you start intermittent fasting, you're lowering your blood sugar pretty quickly. And if there's too much insulin floating around, well, insulin will push your blood sugar down even faster and can create some potentially dangerous hypoglycemic type of symptoms. I've also included in the link below information on that so you could read that as well. So, and then of course, if you are hypoglycemic, intermittent fasting is really not for you. You have to be very careful with that. There's other eating programs that can help you lose weight that are tailored to people that have hypoglycemia, not intermittent fasting. So I hope you enjoyed that. If you have some type of health problem or you're struggling with a weight issue and you want to get help, I've also included another link. I got a lot of links. I've also included another link where you can go to my website and fill out my free online weight loss and health evaluation. That is an excellent tool that we use to help point us in the right direction to what the underlying cause of your weight or health problem might be. And we also do a free consultation with that. So if you need some help, we're here to help. And I will catch you at the next whiteboard session. But of course, share and subscribe. See ya.